morning. It is Monday, February 21st, and joining me, as always, on 5-Minute Mondays is the Institute for Urban Policy Research Director, Dr. Tim Bray.
Good
Dr.
morning,
Bray,
Dani.
Can you show us the dashboard?
Yeah, sure. So as you can see, we continue our downward pace. New cases in North Texas over the last week are just under 13,000. That's down more than half from the 27,000 that we had the week before. And active cases, people actively ill with COVID, we're at 51,000 in North Texas, down 50% from the 100,000 who had COVID a week ago. This is a trend that we're seeing. I'll show that trend graph again, but this is a trend that we continue to see. There we go. Let's take a look at this for the state. So here in the state of Texas, we currently have, there it is, 214,000 active cases. Now that's down from our peak just over a month and a half. Well, actually a month ago, we were at 963,000 active cases. So we're down 80% in COVID volume. We're back now to a level of active cases in Texas that's comparable to where we were in the fall on the backside of Delta. But notice, this is Delta's decline. This is Omicron's decline. Omicron's decline is as steep, is much steeper than what we saw with Delta because the virus came through so rapidly. It burned through the population. So the good news is we've clearly made it through Omicron, and we need to continue, of course, to be vigilant and to stay on top of just healthy practices for interacting with other people.
And Dr. Bray, I have a question for you, and this is something that we'll also cover in tomorrow's event, which I'll talk about a little bit later. But there is just a lot of misinformation going around, and just a lot of, even myself, confused where I can look to find factual, correct information. Can you give some insight on that?
Sure. First off, always go to the reputable sources. And by reputable, I mean go to your county health authority, go to CDC. When you go to those websites, they'll list their sources. They'll tell you, this is the study we read. Most studies can be comprehended by most people, especially the abstract. They'll tell you who they studied. They'll tell you what they studied. Oftentimes, what we find is, well, they did a study, but it was only 100 people. Or they did a study, but it was really only about children, right? That's important for us to have context. The second thing I remind everybody is, we get a lot of mileage talking about Omicron and Delta, but there are hundreds of variants of this virus, most of which aren't that different, right? And so when we hear, oh my gosh, there's a new variant out there, there's a new strain out there, it doesn't automatically mean it's a problem. The CDC only looks at what they call variants of concern, are those that are either significantly different, in other words, they attack different people, or they are significantly more severe, meaning they're more likely to land you in the hospital. So Omicron, for instance, was significantly different from Delta. And we saw that in the attack profile. Very many people got sick very fast, but they didn't get very sick, right? So the existence of another variant is going to be guaranteed. We will see more variants. The challenge for us is to be nimble as we react to that.
Well, thank you so much, Dr. Bray. You always are providing us with factual and important data, and we really appreciate it. Join us tomorrow at 12 p.m. When our UTD representatives, including Dr. Bray and our Chief of Staff, Dr. Rafael Martin, they team up with infectious disease doctors and other medical professionals from UT Southwestern Medical Center and UT Arlington to answer your COVID Year 3 questions. Everything from variants to vaccines to fertility issues. You can watch live on Twitter, or you can register for the Zoom by going to utd.link/COVID Year 3. Thank you.
Thanks, Dani.